after this. I am going to go ahead and get started though, and I just want to say hello, everyone. Welcome. Thanks so much for being here and spending your Friday afternoon. This is going to be our final weekly meeting of the legislative session. Holy moly, we've come so far. So whether you're here every week or you just joined, our group has had quite a presence with our voices being elevated. The name of our group is We the People, by the People, for all the people, and we are a family-driven, family-run advocacy effort. And we do this to improve supports and services for Floridians with developmental disabilities. Our mission has always been to connect with lawmakers through the power of our very real, raw stories. And we have done that to the T this session, painfully so. Um, Quick reminder, this call is recorded. We do that so our friends that can't be here every week can join on our YouTube channel, which is youtube.com/we the pe or for all the people Florida. I'll put that in the link. And I want to go ahead and just get started because we've had an eventful week. One of the most notable
Well, Vivian,
achievements of the week
let me
are.
I'll call you back. Are you gonna be home later?
Hey, Hulda, could you mute yourself if you're not
Okay.
talking? Yeah,
Bye bye.
if you're not talking, please keep yourself on mute because we do have Family Cafe's Legislative Let's Talk at 4 o'clock. We want to make sure that we're on point. This week, finally, House Bill 1103 got passed in the Senate and the House, and it's on its way to the governor. And I wanted to see, Alan, would you mind kind of roping us in onto 1103 and some advocacy efforts we could do?
Yes, thank you, Stephanie. There is great concern that this bill may be vetoed, and I think you all know why. There's a reason they're not putting information on the website that they used to always put on, like how many people on the wait list, what county are people waiting in, and all this information that people are desperate for to know is not on there. They could do that if they wanted to. For some reason, they don't want to. And this bill really is about transparency. And there's other issues on there too, like redoing the formula for how much someone gets in their iBudget waiver. I mean, that's pretty important. I think we all think that, especially when they're reducing people's services, and it's frustrating because you need just as much services. And there's also about time frames and all these things that deal with accountability. If I were a betting person, I would say it's going to get vetoed. And I think what we should work to make it very difficult to veto it, because if they hear from families that they want it, I think it's going to be real helpful. There's other good things in the bill also. I really like the fact that they can't force someone into managed care. That's huge. That's big, and that came from this group. You know that. I mean, they edited the bill because this group made a big thing of it, and I think Carol Gormley heard a lot of it, and she was happy for it too. So we have a draft letter that goes to the governor, and it's copied. We're going to send the letter to everyone on the call, right? And it issues that why the bill is so good, why the law is so good, and it also has a line to copy it to the Office of Program Policy and Budget. They're the people that vet the things before the governor decides what he's going to veto. So we have that guy's email address too that you can copy it to. And then you also have a media person. If you have a local reporter that covers stuff, I would copy them. But otherwise, you can copy Patrick, the person who's been following us diligently these last couple of years and has won awards for his coverage. So what I would say is this: what I'm going to do when I get off the call is I'm going to send the email to the governor. I'm going to copy and paste, cut and paste the email language into the area. I'll make some changes to meet my needs, my unique needs, and why I think it's important and who I am. and then I'll copy the other people and I'll send it. The other thing you can do is there's a phone number. You can call the governor's office and tell him that this bill is important, that you hope he signs it, because they document all the calls and stuff, and it impacts what they do. So just so you know, the goal is to convince the governor that this is a good bill. This is a bill we all fought for, and then we see what the governor does. And let's say he does veto it. That doesn't stop it. Then we go to the next step and try to get them to override the veto. But right now, we're at a point where the governor's going to get the bill soon, and we need him to know they don't care what I think, but they care what families think. And that's why you guys are so important. So if you have other families you know, let's get it generated, and just get as many emails or phone calls or even letters to the governor as soon as possible. And so that's kind of like my pitch on where we are right now. And they're not going to sign a budget, just so you know. You want me to talk about that real quick, Stephanie? They're
Yes,
not going to sign
please.
a budget, okay? They're gonna go home with the policy issues taken care of, and they're gonna come back and do the budget. They say they're too far apart. The real issues they're having deals with tax cuts. Which cuts do they want? Different people want different things. One person wants no property taxes. One person wants no lower sales tax. Another one wants a sales holiday for clothes. So it doesn't really matter that, but understanding that there is a serious disagreement, and so they're not going to pass a budget. So they're going to stop the session. They're going to end it. It's called sine die. And what happens then is they still have to come back, because their only job is to pass a budget. So before July 1st, they have to pass a budget. And they're not going to come back next week, we know, because Senate President Albritton said they're not going to be here next week. But anytime after that, they're going to come back, and then we get to advocate for more money then. So, I don't know if this call's stopping this time. It shouldn't, because we get a new bite at the apple for, where it's just about money. And we all know that, letting 850 million go back to the coffers is not a good thing, but we need the money to be spent. So it's an opportunity for us to continue to give our voice. Now, they say the budgets are really far apart. They really are not. What's happened is one side, I can't remember, I think it's the Senate side, is counting the money from the state, and they're also adding the money from the federal government. So it looks like more money. The House side is only counting money from the state. Because you remember, when you do this program and you spend money, there's a match of money from the federal government. But one side's not counting the match because they want to show this is our taxpayer dollars. But in reality, it's all our taxpayer dollars, because we are a donor state. We give more money than we get back. I don't know if you knew that, but we give a lot more money to federal government than we get back when they do match money. And so that's where we are. I don't think they're going to have a problem doing the budget. This is a rare thing. This doesn't happen often, but they are going to come back and pass a budget, and we'll see where we go. But that's what I wanted to say. And the more letters you can write, I know Brevard County will probably have 300 letters with all their people, but I'm going to try to contact everyone we can contact, and let's just put the pressure on. Let him know that families care about it.
Thank you, Alan. And so if you're a family member, if you're a self-advocate on this call, I want to reiterate what he just said. This bill 1103, it did come from this group. If you were here with us in the beginning of session, it started as a let's wrap everything up and call it, call it disabilities. The APD will handle it. And we as families said, whoa, wait. Let's talk about transparency, the stuff you're supposed to have on the website, the numbers that are reporting. We are having families categorically denied for even having a developmental disabilities. And you guys want to swoop in all these other things. Let's handle what we have now. And so a lot of this bill is about transparency and accountability. And for me, one of my biggest I don't know what you call it, gripes since I first started to get into this was we have these established family care councils all around the state. There are groups of family members that should have a seat at the table to discuss these matters. But a few years ago, there was a major blow up within the states and family care councils about a state run family care council. So guess what? Now we have that. And these state family care councils have accountability within themselves. There will be data that will be accounted for. There will be a way for us to have at the local level listening sessions for families to get other families involved. If I had not joined my local family care council, I would not understand how to help my boys. Being with other families that get it, that's, for me, 60% of the juice, but having a voice at the table that matters is really important. And this bill, it does that. And I've had a lot of feedback from families saying, I don't like that managed care part. Guess what? Me neither. I have found a pathway that helps my families. I want to stay that way. And so what we did as families is say, oh, wait, we just went through this opt-in nonsense. So let's make it short. Let's make it truly optional. And the legislature listened, and that's in that bill too, that this will remain optional. So long as we have a voice, which now through our family care councils, we can do with this bill. We can report that information of what the families need, what the challenges are. And in the language of the bill, when the statewide council gets together, they will be able to gather the information from the local family care councils, give it to the Agency of Persons with Disabilities, and they'll have 60 days to come up with a solution to the challenges we've found as a state. This is a huge opportunity. This is a way to have our voice at the table. So these letters, if the governor vetoes it, man, that puts us a whole other step back, and we're a noisy bunch. Luckily, we have really done the work as far as establishing our relationships with our legislature, and this is a continuation of that. So write your governor, let in your words, in your story, your experiences, why is transparency in this bill so important? Why is this something that families with IDD need to have so that we can have hope? We can have meaningful quality lives where it's not just about surviving, but we can thrive. So I really, really want to nail that home. We do have a Facebook page, Nicole, if you'll put it in there. If you're new to this group started on a Facebook group because we didn't know how to do anything else. And a lot of our weekly communication happens in that Facebook group. I will tell you that somewhere in this past week or two, I made a Facebook page because, like, duh, that's a little easier. So For All the People is now a Facebook page. Yeah, it's still growing with that, but our group is really where we communicate with one another. We'll make sure that we have, kind of a template for the letter to send out, but this is so important that we do this right now. This is a right now action point, and I see Anna with hand raised, so have at it, lady.
Hey, well, welcome home. So I agree with all of that. And all of that is really important. And I think we can continue to foundationally build upon that. It's really a matter of encouraging everyone to use their voice and to trust in the fact that your voice has power. It's not political, it's not partisan, it is you sharing what's happening in your life, what's working, what's not working. And so I am the chairperson of one of our most active family care councils. And we've maintained, in spite of challenges put in our way, we have maintained and we've kept going, and we've thrived. One of my worries, and this is something that I've found along the way, especially when we put on a huge conference every year, and it is a huge undertaking. And let me tell you, the amount of work that I put into this conference that I don't get paid for, tell everybody right now, $0. It's insane. My husband thinks I'm insane. So, but we do it, and we do it because it's important. Now, when I ask APD, hey, can you send information about our conference out to everyone in our area who's receiving services, everyone who's on the pre-enrollment list? It doesn't happen. It doesn't happen. If I ask for data, for example, I could get some data in our meetings because Diana, who is our eligibility supervisor, she is actually wonderful, and she was a parent who had a child who received services, so she gets it. She's very forthcoming with us within the scope of her not getting fired. So, and we appreciate it. She does give us some information, but it's limited, and I'm nervous with this bill. I think Alan's right. And I don't think they want to share that information. And I know as a chair in Family Care Council, when I ask for that information, I have a right to it. I have a right to that data. I can't get it. And what I do get takes a long time, and it's very vague, and it's usually typically very outdated. So I have a hard time because there is a lot of great stuff in that bill, and I'm actually going to be asking our Family Care Council to go ahead and volunteer for planning some of these awesome opportunities that are coming up, listening sessions and such. But how am I going to get that out to all of these people receiving services if APD refuses to share it with them? So anyway, that's my spiel. Sorry.
Well, all the more reason to
Stephanie.
hopefully have you at our statewide council to talk about how important data and transparency is for families, because we want to help one another. This is, so to be on the Family Care Council, it is a volunteer position. This isn't another thing that we do to give back to other families. You know, when my kid had his accident and I didn't know where to go and I didn't know what I was doing, the Family Care Council in my local area wrapped their arms around me and they walked me through. And the reason why I'm so gung ho about family care councils is because that's a huge part of it. Helping families, getting to know one another in our local areas. Like this call is fabulous, but we get to see each other a couple times a year, and you know, we need more family interaction, and and for me, we have an ESE advisory, a special education advisory through our school district. It's called Sharing the Commitment. And it truly is sharing the commitment, where I work with the district, I worked with, you know, community stakeholders, other parents, other, you know, people at that meeting, and we really do build out our programs. So when I heard about the Family Care Council, I was like, bam, it's like sharing the commitment. I got this. Like this makes it work. And that's not what's happened. So that part of the bill is like a baby to me. As soon as I got into this, that's one of the things I really wanted to see, is families having stake in, you know, we are the most lived experience professionals in this arena. And if the state would listen to us, because we are intelligent, we know what we're talking about, and we want to collaborate. You know, one of the things I found really difficult, especially this session, was I have always had the attitude of, all right, well, let's work together. Like, tell me where you're at. I'll tell you where I'm at. We'll try to, like, we can do this. We can work together. And it's been wall, 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 wall. So this bill really says, hey, this wall's got to come down. We want to collaborate. Let's do it. And that's just something I can't emphasize enough. Transparency, accountability. I don't know how else to move forward.
I was going to say, it's also important to note that no bill is perfect, right? I know that a lot of people struggle with pieces of this, and that's honest. That's, you know, that is okay, because that's real. It's just no bill that comes through this process is ever perfect, and everything can always be made better, which is why our voices are so important. And I also agree with Stephanie. I agree with Alan. You know, Melissa has said, and Fino and everybody, Margaret's on the call too. She could probably tell you, you know, these all are a very long process to get to these moments. But one of the key pieces that I find so encouraging here is the transparency. So I put in the chat, I just want to let everybody know, we'll share this in the Facebook group, which the links have been put into the chat. If you're not already on the Facebook group, Facebook page, we'll make sure that we get that there. But I put in the chat the screenshots from Alan's template letter that you can use. I also put in there the contact information for the point of contact at the governor's office that he supplied. And so all of that information will also be shared on the Facebook page, so you can grab it and use it as a template if you would, like to do so. And that's, and in particular for this particular bill, I just really felt like I needed to jump on and say real quick, I understand, because not any of these are beautiful, perfect, this is going to solve all the problems. Every single one of these I've seen come through, there's something I wish they could do more, or maybe a little bit different, or whatever. But I was hoping that at least with this one thing, I feel is so important to reiterate and bold and highlight, because transparency has been such a huge issue for us. We can't do anything without the data, and we need the data. So I think also, Alan, you mentioned, right, that they getting ready to do another survey. Is that right? Like, we're looking at another survey coming out?
I'm gonna see if the providers can do another quick survey to
Okay.
show, because remember, the minimum wage went up in October. We did our last survey in August. So when that hits, the new increase, people start leaving because there's jobs that pay more, but they don't necessarily realize October 1st that that's happened. We're now down the road, and it's becoming harder and harder to hire people. And if we don't get a rate increase in October, it's going up another dollar. Remember, every year it goes up a dollar, and our people get left behind while they're giving nursing homes raises. And it's a market economy. And so we might do another quick survey, not all the questions, just the points that impact them the most. But we'll do that with providers so they can get their information out there, because we need to build capacity. We need more people out there. It doesn't help to get on the waiver if there's no services. And
I
that's
think
what
it
we're
was
pushing.
mentioned, right? In a couple of the hearings, they had that panel. I think Melissa could probably even talk to that. Didn't they say something at one point where they were saying, the House asked the APD, they said, so it's not a funding issue. It's not a support for a provider issue. Then what is the issue of getting people off the list? But I don't remember if it was Melissa that was just kind of like shaking her head or some background.
Well,
We're
they said that we have plenty of
you know,
providers. They said,
yeah, APD specifically said, we have enough providers. We're okay. That's fine. So, okay, but that's not the issue.
Well,
I'm
they
sorry,
said
that was-
what they said was that they were good on providers for
Right, they were
capacity
good.
that they currently had. And it's like, well, what about the additional folks that want to come on to the program? And part of one of the things, and I know the DD Council has, been behind this. I know Alan was behind this, but the Senate had proposed or identified money, about $50 million, to help with onboarding the waiver providers so that we could actually increase the capacity and then have the ability to be able to take the people off of the wait list. And one of the things that I had been asking for is having the people identified by county. Where are these guys located? Where are the people on the wait list located? Once they identify which counties they're in, we can also look at where the people on the waiver are located as well. Pick a color, pick red for waiver, blue for wait list, figure out which counties everybody's in, and then let's start looking at the providers that are in those counties. And the first ones that I would start with would be adult day training and group homes. Let's see how many of those providers are in each of these counties, and then also looking at therapies and personal support, companion, things like that. And I know just from my conversations with a couple of folks at APD, in particular, one of the ones was the ROM of our region. A couple of years ago, he had said to me, he was like, he said, we don't need any more personal support or companion providers in, and he was just using like Hillsborough County, the Tampa area, for example. He's like, we have so many providers. And it was just like,
but it's the quality providers that we really want. You know, anytime that a provider raises their hand, as APD likes to say, and is like, hey, I want to be a provider under the waiver. I mean, it seems that they just pretty much allow, like, you know, anybody that would want to provide personal supports or provide companion do it without there's no true vetting. So if you have these providers in counties where they already have such an overabundance of them, but we need to develop, we have one occupational therapist or there's no behavior therapist in this county, that's where those need to be targeted. And there's a lot of excellent providers around the state that I think that if they did have the money up front and they did know where the people are, that they would be willing to develop providers or, you know, staffing in those counties where we need to have, you know, providers developed, and not just, you know, okay, we're gonna sort, you know, like allow this provider to become an APD provider over here and another one in this county, and we don't know where people are coming on from the wait list, and you know where it's just there's no strategy. There is absolutely zero targeted strategy when it comes to this program. It seems it's just, you know, whenever, you know, when somebody happens to want to, you know, become a provider, they can become a provider. But what about the targeted development of providers that are actually needed in the counties? And rather than the point of, you know, the conversation of having too many, or plenty, I should say, personal support or companion providers, like in Hillsborough, for example, if you have that and you still have more and more and more of those providers wanting to, you know, come into the system, and we already have a lot of them in the county, that just clogs up the process, and people are just, you know, continuing to process these applications for providers that we already have an overabundance of in this county, but we need them over here in this county. So let's try to really look at actually developing it. But so the Senate, with agreeing to that money, which is wonderful, but if the House does not also agree to it, then it doesn't really go anywhere. And that to me would speak volumes, because one of the things that you guys were saying about making the the pilot program optional is, sure, it's optional. You can come on the waiver, no problem, if you want to, but are there really providers over here to receive you? And if they're not going to approve any sort of onboarding money, but they're going to set the managed care pilot up with, you know, they get a capitation rate up front, they've got a lot of money, they're very flush, they also have very slow low caseloads of, you know, 18 compared to 43 over here. The pilot program raised their hand and they were like, we don't want to work with EPD anymore, they're too difficult. And the state was like, oh, you know what, you're right, you guys, you poor managed care people, no problem, we're not going to have you deal with those mean people over APD that don't cooperate and whatnot. You can just deal with ACA, and then ACA is just going to write them a check, and they're going to be able to do things the way that, you know, they want to be able to do it. They have access to the people on the wait list, and they're going to be able to target them with their mail outs, because APD did not do it the right way. So to me, if the House does not agree to any of that money for onboarding providers, that sends a very clear message to me. That says that, you know, yeah, you have the option of going on to the waiver, but you know what, it's going to be very difficult to get over there. That we've already seen that they don't have enough CDC consultants, and there's no waiver support coordinators in these particular areas. But over here, you can come to the pilot, you can come to the managed care side. That's going to be a nice, easy, smooth transition for you. They've got plenty of money, they've got plenty of staff, don't worry about it. So it's like, yeah, you got the option, but is it really, you know, an option? Is it really a doable option? And that to me it sends a message that if they don't agree to any onboarding money, they basically just are wanting the waiver program, I guess, to shrivel up and die. And if that's the case, I really wish that somebody would just be honest about it. You know, like, yeah, we really don't want this to go on any longer. APD is just too difficult. We really would like it to all go to managed care. So please stop wasting your time. I would just like somebody to be like transparent with me about that. But I just don't think that you know, if you look at the comparison and it's like, yeah, we're not going to force you to go onto that, but we're certainly not going to make it easy for you to go onto the waiver, then really is it what kind of an option is that? So,
So Melissa, I'm glad you're bringing this up because I'm reading in the chat some concerns about the IDD pilot with families. And you had sent out like kind of a template email for families to send. I don't know, like a week ago or so. Could you? Yes.
was it like with people calling
Well,
about the onboarding money? Was it that one?
something about the onboarding money.
Yeah,
I
it was
have
the call. Yep.
had a week. Do you think, like, just kind of like what Alan did with that sample letter to the governor, same thing to the House representatives? Hey, you know we have these two options, and in order for them to be true two options, you know, we need a fair shakedown of funding sources. So where's the money? Like, that's my
Right.
off the cuff version, but I'm sure you can make that a little bit better.
Well, I was talking to Doug this morning, and I told him, you know, about that we will be meeting today. And when they do come back to you know, work out the budget, like Alan was saying, I guess it's just that's what they're going to be focused on. There's not going to be policy and stuff now. It's just going to be about the money. I will send and I will ask, you know, you guys to make the phone calls and send emails at that time to help, you know, let them know that and I'll come up with a script. I'll come up with, you know,
Paul
whatever.
said, Steph, show me the money. Remember that?
Oh, that was from like Jerry Maguire, I think,
Yeah.
right? Yeah.
You know, the human head weighs 8 pounds. That line sticks with me forever.
Yeah, I'll but I will send, I will definitely send something out regarding that. I wanted to ask, did you guys all see the letter that Ben Sequenza, I know that some of you did, that he wrote? That thing was spot on. As a parent, as a family member, holy crap. If you guys haven't seen it, I'm gonna
I
locate
shared it to the Facebook group, but
Oh.
I was wondering, you have like really great animation today. I don't know what's in your coffee today, but do you want to read that letter? Because that is, it was its power. And I read that and was like, man, he just said it, dropped the mic. That's what everybody needs to see and echo.
Is
Yeah,
that going to be put on is anybody trying to get that in an editorial?
I don't know where that came. Somebody just texted it to me.
It came from the waiverprogram.com.
I have it pulled up right now.
I'd love to see it be as an
I can pop it
editorial.
in the chat.
Yeah, we need to ask Ven first.
Well, no, I'm saying I would love to see him do as editorial because it's perfect.
I can put it in the chat. I mean, do you really? I mean, I could read it.
Read it.
Okay.
It's worth it.
Okay. All right. I'll start. The title of it is called The Hard Truth About How Florida Has Failed People with Developmental and Intellectual Disabilities by Ben Sequenza Jr. I spent nearly 40 years advocating for people with developmental and intellectual disabilities, and I've watched Florida repeatedly fall short of providing the support this population deserves. While politicians, I love this line, while politicians and agencies continue to praise their own efforts, the facts tell a very different story. Back in the 1990s, Florida had a waiting list of about 15,000 people needing services. A federal judge
I can bring this up on the screen if you want, so you guys can read it as Melissa is reading it.
Oh, you have, okay.
Yeah.
A federal judge even fined the state $10,000 per day for failing to deliver. When Jeb Bush became governor, he worked with the legislature to eliminate the waiting list and created the Agency for Persons with Disabilities as a standalone agency. But the state wasn't ready. That first year, APD failed to spend about $110 million in allocated funds, money that could have gone directly to individuals in need. Advocates and providers warned lawmakers to preserve those funds for the next year. That didn't happen. Instead, APD faced shortfalls, and the legislature pointed fingers, blaming the agency for mismanagement, even though their own budgeting failures set it up to fail. Since then, APD has gone through a revolving door of directors. The waiting list returned. Services have remained inconsistent, and every few years, a new solution is floated that never addresses the real problem, a lack of commitment to long-term person-centered care. The HMO push that never made sense. About 20 years ago, Florida lawmakers began pushing to shift people with disabilities into HMOs. Providers and advocates opposed this move, and with good reason. HMOs are built for typical medical care, not for the lifelong comprehensive support that people with DD/ID require. This population often needs ongoing speech, physical and occupational therapy, plus assistance with daily living. Services HMOs weren't equipped to provide. Even worse, HMOs would take a 15 to 20% cut from already limited funding, meaning less care for people who already don't have enough. And in Florida, it's 7.5% achieved savings rebate, which I can explain that later if you guys want. You can take $40,000 in services, skim off 6,000 to 8,000 in admin fees, and expect the same results. It's basic math. That's assuming HMOs even have the right providers in place, which many don't. Fast forward to 2025, it's only gotten worse. Now in 2025, Florida's waiting list has ballooned to over 23,000 people. The current administration is again blaming APD for failing to spend funds, and unfortunately, this time it's true. APD allowed nearly $800 million to go unspent over 2 years in 22 to 23 fiscal year. Another $145 million in appropriated funds was returned to the state treasury and made unavailable for services. That's nearly $1 billion gone. Money that could have funded services, cleared the waiting list, and changed thousands of lives. Meanwhile, state leadership keeps saying they've invested more than ever in this population, but throwing money at the problem without real accountability and reform isn't working. The system is buried in paperwork and red tape. Providers are overwhelmed. Families are forced to fight through the appeal processes and bureaucratic hurdles just to keep basic services. Millions are being paid to outside consultants who do little more than complicate things. Managed care, a bad idea with a new name. Ooh. Now the state is rebranding its HMO push as the managed care organizations, MCOs, but it's the same idea, just dressed up with a new name. These MCOs still take their cut of funding and offer no real improvement in service quality or access. It's another layer of management, another way to deflect responsibility, and another burden on families who already feel ignored and underserved. In 2024, Florida ranked 49th in the country for funding for services with people with disabilities. That's not spin, that's reality. Yet we continue to see agency turnover, poor oversight, and empty claims of success. Rather than fix what's broken by streamlining agencies like APD, ACA, and DCF and listening to those on the ground, the state is looking for scapegoats. Even the appeals process has been weakened. Hearings that used to go before independent judges are now routed through DCF employees, raising serious concerns about fairness. Let's be clear, families are not the problem. Providers are not the problem. The problem is a dysfunctional system driven by politics, bureaucracy, and a lack of long-term vision. Thousands of individuals with disabilities are being left behind, and the state continues to look the other way. Florida can and must do better. It's time to stop shifting blame, start listening to the people who live this every day, and actually fix the system. I felt like I could have written it myself. I was just like, oh my God, this is like great. And it's sad. It's coming from a parent. You know, it's the struggle that is really true and going on. It does not have to be so difficult. It really doesn't have to be so difficult, but APD is set up to, they worship the process. There's so many things that they could do to streamline, to make things more efficient, more effective, better, easier for the people, but it just doesn't happen. It's infuriating. So anyway.
Thank you. Thank you for
Yes.
reading that. I
You're
know
welcome.
it was a little bit lengthy, but it was absolutely worth it because all of us on this call could have written that. I was ready to just, like light a match, and I got sent his letter and was like, "Oh wait, that's right. Like that's the family voice at work." And Ben is a dad who has been at this since inception. I mean, what a guy. And to be able to get that out on paper, that's something that I would hope that you all read and find encouraging, in a sense that we are bigger and louder than anyone is giving us credit for, and we're starting to show that. But that was a hell of a letter. So thanks for reading that. China, you had your hand raised, and I know you put it down, so I didn't know if you still wanted to say something.
Yeah, I was pre-enrolled to the managed care programs. A friend had to help me opt out. Will it still affect me even though I'm not on the waiver, but I am on Medicaid?
Will opting out affect your eligibility for the waiver?
No, the managed care program.
The managed care, you mean that happened February 2nd, where you had to opt
Yeah.
out of that? Nope, that was covering just medical. So if
Okay.
you were still your fee per service, no, that won't affect you. Now the IDD pilot will also have medical in there along with it, but no, that won't affect you.
Okay, would it automatically enroll people, or do we
No, so
have to put
that was
in?
the advocacy that this group did, was to make
Okay,
sure that we've just gone through this. We just went through this opt-out
yeah,
business. And so they very specifically in the Senate and the House, the language is that you have to sign up for this. You can't just
okay,
roll into it. There's paperwork that has to be dotted. And so I saw a rolling concerns in the chat that, manage care over my dead body, I think was the line that
yeah,
I read. And girl, I'm with you. And that's why that optional piece is in there. So I want to let families know, if you think that bill language is saying that effective statewide, we're all going to get rolled into managed care, not the way this is written. Um,
okay,
so yeah, absolutely not. That's where we went a little hog wild in this group, and thank God. Um,
yeah, because I'm not even qualified to be on the med waiver.
No, no. Okay. Well, let's China, do you have our contact? Do you have
I can ask Miss Deanne for Kelly's number,
all right. I'll put
or do
I'll
you
Nicole,
mine, or
can you put our email in there? Or
Yeah.
I will. Yeah.
yeah, I have my
Reach out to
email
us
up
and
in
we can
another.
talk about ways to wrap around you. What area are you located in?
Mandarin, Jacksonville,
Oh,
Florida.
you're in Jacksonville. Okay, well, we've
Yeah.
got some friends in Jacksonville that might be able to connect with. I see it.
Anna.
Okay.
She raised her hand, so good.
Yeah, you can, I'm gonna put our family care council email in here, and I'll put my ARC email in here, but managed care is not optional with regular Medicaid. Regular Medicaid, you're kind of stuck with managed care. But again, there are no providers who really
Yeah.
accept straight Medicaid, so
Yeah.
you're not losing
Either
out
way,
in
I'm
that sense.
just on Medicaid.
Straight
I had
straight
to.
Medicaid, I'm sorry to interrupt, but straight Medicaid is allowed for patients that are on the waiver. But if
Yeah.
you're not on the waiver, then you have to pick a managed care.
Okay.
So I just want
I'll
to throw
talk
that out.
to I'll talk to my supportive living coach about it.
Thanks,
Yeah.
Phoebe. I appreciate that. Yeah.
Because
Talk with Hannah too.
right now I'm just on Sunshine Health and Medicaid.
I think I see Lily in there. Lily, is that your physical hand raised?
Yes, it is. Hi,
What's
everybody.
up, Lily? Happy
Hi.
Friday.
Happy Friday, everyone. Say hi to Corey.
Hi,
Hey,
Corey.
Stephanie. Hey, everyone.
Hey.
Quickly, I just wanted to touch on the fact Corey's getting an infusion at the moment, so we're in the oncology, so I can't yell or I can't speak loud. But just to touch real quickly on the fact of the HMOs, we're at Holy Cross Hospital, and let me tell you guys that HMOs are not accepted here. So Corey has private insurance. That's why we're here. But isn't it a shame that not everybody deserves the same quality of care? Unbelievable. There's cancer patients all around. There's Corey with her IV. And if she would have had an HMO, Florida Blue, Sunshine, she wouldn't be here. That I'd like to fight for. I gotta mute myself.
Thank
Thanks,
you,
Lily.
Billy.
I would like to fight about that. I'd like to
Yeah,
fight,
Corey.
take that issue on that everybody deserves the same kind of care. And to boot, she needs to have an endoscopy and a colonoscopy because she's bleeding from somewhere. So immediately when I left here the first time we came, on the second day, I got a phone call from one of the doctors, immediately to make an appointment at this hospital. I said, look, I'm staying with the hematologist, but I want you to know that I am not picking any of your doctors because you guys don't accept HMOs. Corey has lupus. I said, that's not the point. Others do. And if they don't deserve the same kind of care because the person has an HMO, then it's not a hospital that I'd like to come to. I'll stay with Dr. Blanc, but I'm going to Cleveland Clinic where they accept HMOs, like for her. Not that she has it, but you know what I mean? So I
Right.
stood my ground. I'm not giving you my money because you don't help others just because they don't have private insurance, Blue Cross and Blue Shield PPO, which is what Corey has. That is wrong. Okay.
Thank you so much for sharing that.
It's
Leslie.
very wrong.
I'm gonna send
Really?
prayers also for you and your daughter. Yeah, because I
She's
mean,
fine.
wow, you guys are on the call at the hospital, so it's just yeah.
That's the reality
fine.
of
Our
our
reality,
families.
right?
We love you, Corey.
I love you too.
Tom, what up, G? I see your physical hand, sir. You're muted.
How's that?
That's good.
Hey, everybody. So, yeah, the whole thing about managed care is about money, not about people. And we're about people, not money so much. And so, as I've been consistently saying, the whole protections of early periodic screening, diagnostics, and treatment was created to protect poor kids, make sure they got the right care. For children with special health care needs, historically, Medicaid state plans have been the best insurance as opposed to private insurance. When we're in managed care, these companies get a fixed amount of money per client, regardless of their needs. And that means that when you are a high utilizer, you're draining their profits. And it's about money and not about care so much. So it is really important. And I'm really grateful for people, including myself and my daughter, that did go to Tallahassee and did really say that this managed care needs to be something that you have the option of doing, not something that you get dumped into and that you have to figure out how to get out of. You know, it comes down to our voices do matter, and the work and the stories and the real human face of developmental disabilities is one of the most powerful things that this organization has done. Is that we have created allies in the legislature that didn't know, didn't understand. We're just looking at budget items, and it became the Logans and the Coreys, the Shelbys, and real names of real people. And you know, I would just in the challenges of today, I think one of the most important things that we can do is reach over your shoulder and pat yourself on the back because of the truth that we say and the stories that we've told and the honesty that we've shared. It is a different day. Is it perfect? No. Are we going to keep fighting? Absolutely. But the strategies of putting a human face on it has really been powerful, inspiring, and impactful. And I want to thank you all for the honor of being part of this. And thank God we did it.
Almost, we did it. Tom, you popped in late, so we're gonna
Hey,
wrap up here,
Stephanie.
and then I'm gonna
Stephanie,
open
it's
it up. Yeah.
Fino. I'm sorry.
Yeah.
I just wanna, I'm sorry I cut in here, but I just posted an article that I got last night. I just want you guys to listen to this. The DOJ also said that Aetna and Humana conspired with a broker defendant to discriminate against Medicare beneficiaries with disabilities because they perceived them to be less profitable, just bouncing off of what Tom just said. So I just posted that article I just saw it on the group here, group chat. So I just wanted to kind of throw that in there because Tom just made that point.
Thanks, Pino. Thanks, Tom. That was good tag teaming.
Yeah, that goes in. This is Melody. It goes in with the managed care dental thing because our individuals who go on to Medicare and then have Medicaid as their base because of either a parent on disability or a parent retires, the Medicare won't pay that dental, and then our specialized dentistry who took the state plan Medicaid won't take Medicare. So it has been a real life-threatening issue. So I got some parents that raised up in this area to make a resource list of those who will help in the minute of an emergency. So
I would really like to point out that there is an Oral Healthcare Alliance and advocacy group that's run with the Florida Voices for Health. I can put the link for that in the chat for anyone who is interested in joining and being a part of that coalition of voices that's advocating for oral health care for our IDD community.
put it in the chat so I can copy it. Yeah.
Yes, absolutely. So to that end, I really wanted to talk about this real quick before we got off the call, and that actually just gave us the leap to that. So I'm going to share my screen one more time because I want to show this. Next week on Wednesday, I believe, is the Florida Voices for Health Summit in Lake Mary. I love the focus of the summit is hope and healing in our fragmented democracy is the kind of the title, and they have a fantastic list of guest speakers that are going to be
do
there.
they? One of them in this group, Nicole, just say it. Just speaking.
Yes, they asked me to speak on the second day. So I will be doing a panel about community coalition building. So that's on the second day, but other people much smarter than me will be speaking. So those are the ones I definitely want to point out too. JJ is going to be there. And a lot of other people, but they're also going to be offering a virtual option. So I'll make sure to put that link in the chat. So if you guys have time Wednesday, Thursday, please make sure to log on for that. And then I'll also put information for the summit.
And Florida Voices for Help has been an excellent partner with our group. And they actually wrote and said, if anybody from We the People, By the People, For All the People would like to go, that free tickets for us. So I posted that. There's you know, those Cody things on our Facebook group. I posted that in our Facebook group. We can pull it if you're interested. Reach out.
Yeah, in the car. But this
So good. Thank you, Nicole, because that's what I was trying to get to, is to make sure that everyone knows that although the House and the Senate are going to take a week off, we're going to take a week off too and try to figure out how we're going to gear up for next session while we all write those letters to our governor. I can't stress that enough, that if you want transparency, accountability, and family voices at the table, to use Alan's letter that he put down there in the chat, and we'll make sure it's on the Facebook, and send that off because without our voices, we're going to get vetoed. I know several faces and names on this call where we all went to Tallahassee for this. Like, we have blood, sweat, and tears over this bill, and for our family, because we love them. So I can't push that message more. That is our homework assignment for the week. While everybody else goes home and enjoys their family, we're just going to send out this letter. And if you miss us, go see Nicole at Lake Mary. Log on to the virtual thing for free. And then June 13th through the 15th is the big family cafe in Orlando, where we will again be presenting. We're presenting at 11:30 on Saturday. So if you're unable to come Friday, we're right there. Huh?
Prime time.
Do you
Yeah,
have
this
to?
is an ideal time to be able to go so that we can further our mission in this group. And by then we'll come up with a calendar on how we're going to move this wheel forward. We really want to organize a little bit better because we know that next session is a little bit earlier. We're all going to be in Tallahassee around Christmas time next year, so things really get started way towards the end of summer. And so we really need to get up our game plan. I'm going to go ahead and turn the record off so we can just take ourselves